Hi everybody, thanks for joining us. I'm Phil Fatika. This is the Millcreek Government Channel. I'm joined today by two lovely women to talk about something that is most important to everybody. First, on your left, let me introduce to you Lynn Gotham. Lynn is the coordinator for the American Parkinson Disease Association Information and Referral Center. Long title?
It's a mouthful.
It is. And sitting in the middle is Jane McCartney, and we'll talk to Jane in just a moment and tell you why she is here. Parkinson's. Everybody's heard about it. Everybody knows it. Michael J. Fox. So out there, everybody goes, Parkinson's. Yeah, that's... What is it?
Parkinson's is a neurological disorder which affects a certain section of the brain where a vital chemical called dopamine is produced. And for some unknown reason, the brain is affected and the dopamine levels suddenly start to drop. And this chemical is vital in movement, coordination of movement. So it actually affects all systems of the body. And currently there is no cure for Parkinson's. Average about 1 out of every 100 people over the age of 60 has Parkinson's, but certainly there are people who are in their 30s and 40s that are also diagnosed as well. And some of the hallmark symptoms of Parkinson's would be tremor, especially a tremor at rest, rigidity, so stiffness, stooped posture or other postural changes such as balance issues, shuffling walk, and also a slowness of movement. Those are the 4 hallmark symptoms. However, not every Parkinson's patient will have all 4.
Now that brings us to you, Jane. I'm sure you gathered by now why Jane is here today. It's your story. You go ahead.
I was diagnosed officially about a year ago. Prior to that, I had been seeing Dr. DeMattis for about 3 years. Because it takes a while to diagnose Parkinson's because it is so different. Everybody has different symptoms. The symptoms progress differently in everybody. Not everybody has the classic symptoms, so it takes a while. And then a year ago, he officially, ruled out everything else and said, yes, it's Parkinson's.
Many questions are flying to my mind. The age seems to be more post-30, post-35, post-40. I mean, it's not a young person's quote.
No, actually, most people are diagnosed after the age of 60.
Okay. Are there various, what's the word I'm looking for? Intensity of Parkinson. You can have Parkinson this wide, or you can have Parkinson that wide. Or what is its spectrum of how does it affect different people different ways?
Yes.
Okay.
Parkinson's actually affects people very differently.
And do they know why?
No.
Okay.
As you started, you alluded to Michael J. Fox, and that's one of the good things that has happened is it has increased awareness because someone of Michael J. Fox's familiarity with the public. Muhammad Ali is another one. But at the same time, it's kind of a double-edged sword because then when people encounter those with Parkinson's who don't look like Michael J. Fox or Muhammad Ali, they may question whether, well, do you really have Parkinson's? And even those who are being diagnosed, because it is such a process for some folks to be diagnosed, sometimes they have a harder time even believing that they have it because they don't look like Michael J. Fox or Muhammad Ali. So it really can vary from person to person.
Is it possible, when you mentioned Muhammad Ali because of his repeatedly getting hit, and maybe people in the conversation today in the NFL are the amount of trauma to the brain that Junior Seau just committing suicide. Did you have any of these, Jane? Does any of this ring? Did you have any physical punishment or anything that would ever lead you to believe that this would be nothing?
No. And by the way, I'm not 60.
Oh, I was just going to say that. I don't think you've celebrated 21 yet. They're going to card you when they get out of here to go somewhere and get a drink.
No, Not that I can recall ever having any major head injuries of any nature.
When you said you were dealing with a specific doctor for a number of years, why'd you go there? What was the diagnosis? I guess the ultimate question is, how was it diagnosed?
I was referred there by another doctor because I was having tremors, primarily in my left hand. Like right now, I don't have them.
No, solid.
They come and go.
Okay. Does stress play any part in it?
Yeah, stress can make it worse.
You're not stressful here, are you?
No.
Okay, good.
I also have it over there, a walking stick, because I am affected with my balance. And there are times that I need that stick to help me. Other times, today I'm not using it. I just brought it along.
Any, off the top of my head, air pressure, barometric pressure, because we all know that our joints have fluids. And you talk about people who know, I know it's going to rain, you know, because the fluids just change and push on their body and go, oh, I just know it. You know, I mean, the moon and the gravitational pull against all of that, because you mentioned it has to do with a chemical in the brain called dopamine.
Right.
Can they then alter the chemical with medication? Can they make it higher, stronger? Make it work better, make it work less, like insulin?
Well, the hard answer to that is...
There's about 4 hours of questions.
Right, is yes. Neither Jane or I are neurologists nor biochemists, so you know we're going to give you the easy answer to that. But yes, there are medications that can help to increase the flow of the existing dopamine or to put a synthetic type of dopamine within the body. However, these are not a cure, and they unfortunately have a period of where they will work, and then at some point the body gets resistant to that, so you need more and more of the medication to work, and then you also will find that the side effects can often cause a great deal of problems. In fact, often people see Michael J. Fox with the dyskinesia, the wiggly jigglies, and they think that is actually part of Parkinson's. That's actually a side effect of the medication that he takes in order to be able to function, to be able to go on an interview. He needs to be able to make sure that he's on an on period with his medication, but oftentimes because he's been on those medications for so long, he gets the wiggly jigglies, the dyskinesias. So again, that varies from person to person, but you know, each doctor will look at the patient and see where they're at. Some doctors, if the patient is very mildly affected, may even say, let's hold off on some of the medications because we know we have a window of how long we may be able to use them. So we'll wait and see. But other patients need it right away. And you know, thankfully they're coming out with new drugs. They're working on things, and they're just within the last 20 years there's been great advances. In addition, there's now a surgery that many people may have seen on television. It's been featured a few times on different news programs. It's called the deep brain stimulation surgery, shortened DBS. And this is basically a pacemaker in the brain. And they're not 100% sure why it works, but they know that it does. So they hit a certain portion of the brain where if they get it just right and the person exhibits certain symptoms that are ideal for the surgery, tremor is a big one, they can actually hit this spot with the probe and you'll see the tremors actually quiet. They do this surgery awake. If people Google that, they can actually see online the actual video of the surgery, and it's just fascinating to watch.
Jane, where are you then on the scale of medication? Because before we started taping today, she said, I have my alarm on my watch turned off. Does that for your medications?
Yes. I was on one medication to start out, and it lasted a year and a half maybe. And then the effect of it wore off. I mean, it was increased as it wore off, you know, the dosage and stuff. And that medication was then dropped, and I was put on another medication, and again that started out at a lower dose, less frequent during the day, and then as that started to wear off, they have increased, you know, how often I take it, and so far that's been it. So I've been fortunate.
Obviously, I don't mean to be prying here financially. Does insurance cover this at all? Do you get any kind of a break on the medication? Is the medication extremely expensive or doable?
For me, I am fortunate that my husband has good insurance. So it's not a financial burden for me at this point, anyhow. Yeah.
Okay. You touched on something, Lynn, about the research and the probes. It seems that because, I have to use Fox because he is the most visible example of this, that this has sparked this impetus to do the research and know more about it. Forget I even said that. What did they do with people before they knew a lot about it? How were they treated? How were they, what happened to them? Did they simply go and say, well, Jimmy's strange and he'll sit there in the corner until he stops being strange?
Well, actually, we can go to Hollywood again for the example to this. If you remember the movie Awakenings.
Oh, sure, absolutely. I was just thinking about that. Yeah.
That is actually the
dopamine.
Is what how they found the synthetic dopamine. So often people who had severe Parkinson's and they could actually be frozen because they had not enough of their own dopamine running through the system. So it's been
is there a test at birth to determine this, or does it kind of go as you get older?
Actually, there's two schools of thought as far as, there's more than two, but probably two main schools of thought where the research is going right now. And there are some who believe that this is caused because of environmental factors, pesticides, pollution, any different kinds of exposure to chemicals. And again, we're talking about the garden variety of Parkinson's that someone like Jane has, not something that's been inflicted like Muhammad Ali's situation. Now there's another school of thought that says, well, while we don't have, in most cases, a direct genetic link for Parkinson's, they do believe that perhaps it is something that is within the genes. Those two schools of thought in some cases are coming together, and there's some scientists who are now thinking, okay, well maybe certain people carry some sort of a genetic marker, and it may not be an inherited marker, but that there is something, and
so
then
you can pass it on.
And well,
can you quote a broad word, inherit it?
In most cases, no. In most cases, no. At least that's the current research right now. There is a certain type of young onset Parkinson's that does seem to have a genetic component, and it does tend to run in some families more than others, but for the vast majority, people look back and they go, there's no one in my family with Parkinson's, how come I got this? But back to those those schools of thought, they're starting to think that, okay, well maybe there's a marker, something that someone's carrying in their body, and then some exposure from the environment has triggered something within the body to create this. The biggest problem with getting someone diagnosed with Parkinson's is by the time that they're diagnosed, the average person has already lost 60 to 80% of their dopamine. So we're dealing with a major reduction in what someone without Parkinson's would be dealing with on a normal basis. So it's a really depleted supply. And the reason for that is because most people are diagnosed as they age. So when you're slow, one of the hallmark symptoms is slowness of movement. Well, when people slow down, they tend to think, well, I'm just aging. I'm a little off my tennis game because I'm a little bit older. Or I'm stiff. Well, they blame that on arthritis or, again, getting older. Typically, the symptom that gets people into the doctor is exactly the one that got Jane in, which is tremor. Again, I'm flying with questions in my mind here.
And please hop in. And one of the questions that I wanted to ask you is the importance of exercise to the patient. Why? Jane?
Because if you don't use your muscles, you lose them.
Is it difficult to use them, though? Is it like, I don't want to do this?
For some people, yes, because their disease has progressed so far. For me, I don't have a problem yet, but if I don't exercise, if I don't keep up with moving.
Even walking?
Right.
Just, I mean, walking.
I walk well, I'm supposed to walk every day.
Okay, I'm going to tell your doctor you're not walking.
I'm trying to walk every day. But yeah, it's important. You know, you need to stay active so you don't lose that flexibility in your muscles.
There has to be a website, a phone number, an address where people can go to find out more about this, because how are you funded? You know, I mean, it takes a lot of money to do research. Millions.
Well,
billions.
right.
And so locally, how do they find out about what it is that you do, or to say, gee, I think that maybe phone number, website, whatever?
Well, there's two different places. I'm all Parkinson's all the time, but I actually wear two different Parkinson's hats. As you said it earlier, I am the coordinator of the American Parkinson's Disease Association, and we have an information and referral center here in Erie, and that's at Health South Rehabilitation Hospital, and my number there is 814-456-4210, and people can call me there and get lots of information about local resources, support groups, and such. Now, I also, thanks to the generosity of Hammett Medical, UPMC, Hammett Medical Center, we have a Parkinson's Partner Support Group, which I am actually employed by Hammett to help that.
So there's a lot of
group.
Advocacy people.
Right.
If you getting in touch with you will get you in touch with a lot of broad advocacy people, and you can point them in the right direction as to what to do and where to go. Okay. I like what you said a little earlier about the environmental. Have there been any studies that you would say jungles of where nothing seems to be is like we have it here, they don't have Parkinson's? Or is the incidence lower there and higher here because we have 150 years of breathing fumes and pesticides? That was a kind of fascinating thing, I thought. They can make a link to the environment. Actually,
in what we would traditionally call the Rust Belt and more agricultural areas, there do tend to be higher rates of Parkinson's. So I think they are looking into that, but I don't know that we, as of yet, have enough data to conclusively say that that's what it is. However, there was a recent study done in California where they found that there was a higher incidence of Parkinson's among farm workers where they were using pesticides. And interestingly, they also found that workers who were actually in office buildings nearby, but whose windows were open during the spraying periods, they also found that some of those folks tended to have higher rates of Parkinson's.
So Jane, you weren't around that?
No,
you weren't farming.
Nope.
Working in a building where there was huge amounts of spraying going on, or anything like that.
Nothing like that.
Nothing like that. Take us through your normal day. You get up and you do what?
Actually, I go to an art studio. I go to.
You're not really to Paul McCartney.
No.
But you wish you were.
I wish I was. I go to an art studio for art therapy.
Oh.
And I go there 1, 2, 3 days a week, 4 days a week, something like that.
Yeah.
And we do a wide variety of things.
Have you always been an artist? Did you work?
No. Oh, I work, yes. But I never, my artistic ability, I thought, was always limited to drawing stick figures.
Yes, me
and
too.
Then I discovered that, yeah, I can draw, I can paint.
Wow.
I can make things out of all kinds of, I don't know, we do all kinds of things, that's all I can say. I mean, it's everything under the sun, you know, that we do.
Again, I want to come back to the fact that they've been able to diagnose this because of a lack of dopamine.
Right.
And synthetically, they've been able to reproduce this somewhat. But it always doesn't work the same on everybody.
Right.
And you said a staggering number there that before you really have been diagnosed, you might have lost 60 to 80%.
Right.
Yes.
And there's no trigger that says, hey, something's not right here?
Well, no, because again, the symptoms are very subtle. When you're talking about a slowness of movement or changes in your posture, the way that you walk, talking about stiffness, again, a lot of those things can be dismissed because as people age, they just assume that's part of the aging process. So unless tremor is exhibited or, you know, something else that may be, some of them may be off symptoms of Parkinson's that are not as well known. There can be digestive issues, things like that. Because again, dopamine runs through the entire body, so virtually every muscle system in the body can be affected.
So has this been something that would be a modern disease, or if you go back 200 years, people went, you know, there's not much research that indicates this was going on? Or did they call it something else at the time, perhaps?
I believe it was in the late 1800s. The Dr. James Parkinson named it the shaking palsy.
Yeah,
so it had been out
palsy.
there before, but I believe that's when it sort of got the name attached to Parkinson's.
Okay, okay. You look great. You look great.
Thank
I mean,
you.
you seriously do. You look bright, and you walked in here, and I saw that you had your walking stick, as you call it. And you have a great attitude.
Thank
you.
you.
I would assume that plays a great deal
It does.
In what you do.
does.
And you have a lot of people supporting you.
Yes.
Your husband?
Yes.
Do you have a family?
Yes. Family and friends and church members. Yeah, and the support group.
Yeah.
We support each other. We're all in the same boat, and you know, we're very supportive of each other. Not to say that I don't have bad days. You know, I do. But you know, the hardest part for me was telling my children. They're all in their 20s, but that was hard for me to tell them because obviously at that age span they're old enough and intelligent enough to realize what this is, and that was hard. But they're very supportive, you know, and helpful.
Well, they have such a good role model in you, absolutely. There's just so much here to talk about with Parkinson. Do you ever think that it would ever get the cachet that Jerry Lewis comes on, does a telethon for how many years, and everybody knows what he's talking about, and Michael J. Fox occasionally pops up, you see him even appearing today in television shows, going, well, he looks okay, you know, he's not doing too badly. Is there any movement toward a national coalition of pulling us all together and saying, you know, if we can raise $800 million, we'll have this thing licked?
Well, isn't that the question of how much it would take to actually get this thing secured? The challenge with this is there are a lot of national Parkinson's organizations, unlike MS or cancer, some of the other ones where there tends to be one identifiable organization. Parkinson's has a number of them. However, one good news is that there is now a unity walk. It's been going on for a number of years, and all of the major Parkinson's groups get together, participate in this walk, and they raise millions and millions of dollars for research and support for the Parkinson's community. That's held annually in April in November in New York City.
Yeah, have you ever participated in those? Or do you know
No.
people, or no? No? Do they have one here locally, or is it more geared toward the big one in New York?
Actually, this year we had a walk and a run sponsored by a local group, Running for Parkinson's, which was founded by a young onset patient herself. And we did that in April, and $4,000 was raised for the American Parkinson's Disease Association.
Small steps.
That's right.
Small steps. We got about 2 minutes left. And you're pretty familiar with Lynn. She is the Parkinson's Disease Association Information and Referral Center Coordinator. And she's told you all the facts, and Jane has agreed to be so lovely and so nice and come on and tell us about her dealing with Parkinson's. Jane, I'm going to give you a last word here. Words of encouragement, what to do, where you should go, etc. It's all yours.
Call in.
Okay.
We do have an exercise program twice a year, 3 times a year.
Yeah, we're starting again
like
in
that.
September.
And it's exercises that are specifically designed for Parkinson's patients. It's run by 2 people who are the heads of what?
Well, they're an occupational and physical therapist from Gannon University.
So they're
Jane
the
really,
pros.
Lynn really has the 411 here.
Yeah.
Thank you so much for being here.
You're welcome.
Thank you so much for being here.
Thank you for having us.
Thank you so much for being here. Until next time, take care. I'm Phil Fatika.